Okay, good evening, everyone. Thank you so much for joining us tonight for this live in-person discussion with our Medical Officer of Health about keeping our schools safe in the era of COVID-19. We've had about more than 60 people register for this event. We're so pleased to have such a great turnout. My name is Brittany Cadence, and I am the Communications Manager here at Peterborough Public Health. I'll be your MC this evening, as well as the moderator of the chat function. If I could have the next slide, please. So as we gather, I would like to start us off with a land acknowledgement. We respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. We recognize also the unique history, culture, and traditions of the many Indigenous peoples with whom we share this time and space. We give thanks to the Métis, the Inuit, and the many other First Nations people for their contributions as we strengthen ties, serve their communities, and responsibly honor all our relations. If I could have the next slide, please. Thank you. Now, I know you're all very keen to engage with Dr. Salvatierra, and she's just as keen to engage with you. But before we begin, I would just like to touch on a few housekeeping items and explain how tonight's presentation is going to work. We would ask that you mute your mics for the duration of the event, and please type in your questions using the chat function to ask them. Dr. Salvatierra's presentation is about 20 minutes long, and I will be monitoring all the questions that come in through the chat box so that she can answer them at the end of the Q&A. There's more than 60 people, as I mentioned earlier, joining this virtual meeting, so I'm sure you can appreciate that a verbal discussion isn't really feasible, but that's why we're encouraging you to type in your questions. And I'm very pleased to share with us, I'm very pleased to share that joining us this evening as well is Carolyn Doris, our school health manager, and she's on hand to also help answer any questions. We are respectful of everyone's time, so if we're not able to get through all the questions this evening, they will be gathered from the chat box at the end of the event and answered in a Q&A document that will be posted to Peterborough Public Health's website shortly after the event. So we have your email addresses and we'll send you the link to that document. And we will also include any questions that we might not be able to answer tonight because perhaps more research is required. And any questions that come in that require a response from the local school board will be noted and shared with them as well. So if I could have the next slide, please. So a few disclosures just to note off the top, and then we can get underway. A recording of this webinar will be posted to Peterborough Public Health's website after the event, and that's for your reference, and the recording has already begun. This presentation has been prepared based on information current as of today at 4 p.m. This presentation is intended to provide education only and is not legal guidance. And we have crafted this presentation for families within the city and county of Peterborough and Hiawatha and Curve Lake First Nations. Participants from other regions must consult with their own local public health unit who is responsible for the area where they live. Private schools and homeschools are not regulated under the same guidance as publicly funded schools. However, they are encouraged to follow the same guidelines. So with that, it now gives me great pleasure to introduce the Medical Officer of Health for Peterborough Public Health, Dr. Rosanna Salvatierra. Take it away.
Thanks, Brittany. Hi, everyone. So as adults, we wear many hats, and probably one of the most important roles we have is as parents and caregivers of our children, the next generation. So it gives me great pleasure to be here tonight with you. to answer your questions and respond to your concerns, whether your children are back in the classroom or whether you've made the choice to keep them at home as virtual learners. We'll go through the slides, and as Brittany said, there will be time for some additional ones when I'm done the presentation. So just to begin, I think we're all aware that schools reopened in September after being closed for many months. And in the summer, as we were preparing for the fall reopening, the Ministry of Education released its Guide to Reopening Ontario Schools. And the guidance in that document was intended to support the safe reopening. It did include input and advice from provincial public health measures table and some of the public health measures that were integrated and incorporated into the safe reopening of schools, and the use of cohorts to minimize contacts, as well as opportunity for hand hygiene, the maintaining of physical distancing as much as possible within existing schools, the use of masks, both face coverings for children and surgical masks, and eye protection for teachers and other staff, screening, and also enhanced cleaning and enhanced public health presence in schools. So we were able to create a team of school public health nurses. So if I could have the next slide, please. Thanks. And I'm going to invite Carolyn Doris, who is our school health manager, to speak a little bit about the school health team that we've been able to put together for you here in Peterborough. So over to you, Carolyn.
Great. So you can see that we have a multidisciplinary group here that has formed our school health team and includes public health nurses, health promoters, registered dietitians, and administrative staff who are really have come together to support our school administrators with credible, comprehensive information to really support a safe and healthy return to school. Our nurses are connecting and meeting with principals and vice principals of our publicly funded schools regularly, and the team is also working to support our local First Nations schools as well as independent schools. Now, certainly management of our COVID-19 cases and contact management have been priorities, along with the startup of our student nutrition programs. And we're really fortunate to be able to work with other public health colleagues who may not be part of this team per se, but are certainly as part of Peterborough Public Health, are lending their expertise in many areas, including infection prevention and control and health equity, and also health and phys ed curriculum support for the staff of schools. We're certainly collaborating with our 3 district school boards locally and also our neighboring public health agencies, and that's really necessary to have a coordinated approach in messaging. And along with certainly our focus right now on COVID-19, this team also is really grounded in comprehensive school health, and which is linked to the Ministry of Education's Foundations for a Healthy School, and it recognizes the importance of student and school and classroom through curriculum, leadership, engagement, and the social and physical environments in the school setting. And certainly the importance of home, school, and community partnerships is a real key to healthy schools. So we're really pleased to have you all join us tonight. Back to you, Rosanna.
Okay, great. Thanks very much. So we've put together some slides in response to the questions that we received over the last few weeks and into the weekend. And so I'd like to begin just by talking a little bit about, or answering the question I think that most parents have, and that is, are schools safe? The reality is that until we have a vaccine to protect our children, the most we can do is to use all of the public health measures at our disposal. And that includes active daily screening, hand washing, physical distancing, face coverings and masks, and cohorting. Now, cohorting is probably a new word for parents, but it's not a new word for us in public health. We use it in long-term care homes or in hospitals as a way to prevent and control outbreaks. It means in the school setting, it means keeping children in small and consistent groups. That limits their contacts and therefore their exposures. If there is a sick child, the rest are automatically treated as close contacts. So it does mean that some will get caught in these protective measures that may not have been necessary, but it is very comprehensive and it shouldn't miss anyone. Cohorting children is one of the cornerstones of reopening schools in Ontario. I also wanted to share with you that just last week, the National Collaborating Centre on Methods and Tools published a review of the evidence. And the question that they asked was, what is the key role of daycares and schools in COVID-19 transmission? So I'd like to share with you some of those key learnings from that evidence review. First of all, a large cross-sectional study from the United States found no association between attendance at a childcare facility and COVID-19 as an outcome. There were 2 new studies and also an evidence synthesis that found that it was adults that were most commonly responsible for transmission, both in households and in childcare settings. There were 2 additional new studies that described household transmission outside of the school or daycare settings as ways that infections get into schools. And so that's from socialization at family gatherings or overnight visits, etc. So the key points that I wanted to share with you from this recent evidence review is that the risk of transmission from children to children and from children to adults in primary schools and daycare settings appears low, particularly when infection control measures are in place. Now, the certainty of the evidence is also low, and the findings may change as new data become available. But when we look at clusters and outbreaks, both in the childcare settings and in school settings, it's adult to adult transmission that seems to be more common than child to adult or adult to child. If I can have the next slide, please, Claire. So what have we seen so far in Peterborough? As of October the 26th, so today, we've had a total of 5 cases in all of our schools. We've had 1 outbreak, and that was at Adam Scott, and it was declared over on October the 11th. We had 4 cases in total, but only 1 of those cases was transmitted potentially at school. We had 1 case at Highland Heights with no evidence of school transmission. So I think this is a great start to a new and hopefully and what will probably be an unforgettable school year. So I just want to start with a big thank you to everyone, including all of the parents who are helping to keep students and schools safe. So I'm going to begin now with the frequently asked questions, or at least your questions. We have around 10 of them, and these were gathered from calls that we received on our hotline, as well as from some of the emails that we received during the week. And I've added a couple of late coming emails right at the end. So if I could have the next slide, please, Claire. So my child only has a cold. Do they really need to have a COVID test? The answer is it depends. The newest version, you'll notice that the online assessment tool has been revised, and it divides the symptoms into 2 groups. The first set of symptoms are the ones that are more commonly associated with COVID. So just 1 symptom of either fever, cough, breathing difficulties, or a loss of taste or smell is enough to warrant testing for COVID. However, there is a second group of symptoms, things like sore throats and headaches and runny nose. So if your child has only one new or worsening symptom from that group, it's safe to keep them home for 24 hours and just to monitor them to see whether that symptom gets better or worse. If within 24 hours your child starts to feel better and the symptoms are improving, that your child can return to school or to childcare when they're well enough to do so, and COVID-19 testing is not needed. However, if that symptom persists and is getting worse, or your child develops a second symptom, so let's say now they have both a runny nose and a cough, or maybe they had a sore throat to start and now they've got a headache. Well, that would be reason to seek medical testing and potentially get tested. Next slide, please. So for all of those parents, I just wanted to take a moment to recognize all of you who were stuck in the long lineups at the drive-through assessment center here in Peterborough that first week of school. And for all of you who waited for a test result, you all deserve a trophy, a medal. The good news is that the testing system has been fixed. So that should be a relief for all of you. Next slide, please. So the second question is about testing. How do I get a COVID-19 test for my child? There are several places in Peterborough where you can get testing. And for example, we have some family doctors who are doing their own testing, but very few. So if you do have a family physician, you can check in to see whether they're testing or whether they prefer their patients are seen at the assessment center or go to the driving site. The important question is your child sick enough to warrant a physician's assessment? And if the answer is yes, then the place to go is the assessment center at PRHC, because you don't know, potentially a sore throat and a fever could be strep throat, or maybe the child has an ear infection, or maybe it's a flare-up of their asthma. If your child needs to be assessed, if somebody needs to put a stethoscope on them and have a listen to their chest or look into their ear, that's a reason to call the assessment center. And there is a direct number, it's on the slide, 876-5086. Their phone line is staffed from 8 o'clock in the morning to 4 p.m. and it's 7 days a week. And that is the best place to go with a child who's really sick. With one caveat, and that's the second point on this slide, and that is if your child has severe symptoms, so if they're short of breath, having difficulty breathing, or let's say they're very lethargic and they're not responding, that child needs urgent assessment, and you can call 911 or you can take your child to the emergency department, alert the 911 dispatcher of your child's symptoms, and that child will be tested as part of their assessment in the emergency department. Okay, next slide, please. Now, for the rest of us, and for the rest of your children who don't need to have a physical assessment, they can go for what used to be drive-through testing, but as of today is now testing at the North Crest Arena at 100 Marina Boulevard. So the paramedics have moved indoors to accommodate the colder weather through the fall and winter seasons, and you can book online. We have a link from the Peterborough Public Health website, as well as Peterborough Regional Health Centre has a link. You book your appointment. We have same-day appointments, next-day appointments, and they can be tested there. We also have one other place in Peterborough for testing, and that's for people who don't have symptoms, and that's the Shoppers Drug Mart on Lansdowne Street. They are offering testing by appointment only. People can call that their number and book testing. For example, if you're going to visit someone in long-term care and you need a test, or if you need it for international travel clearance, or before a procedure or surgery. So we have lots of options now for testing. Next slide, please. The other news that I'd like to share with parents is that although the nasopharyngeal test is preferred, and that's where they put the swab down into the back part of the nose, there are other options for testing children or for someone who's just refusing an NP swab. You can do a test just in the nostrils. You can do a test just in the throat, and the province is working on a new saliva test where the child swishes some saline and then spits it out. But that test, it's coming, but it isn't here soon. In the meantime, the combined throat and nostrils test for children is a very good testing combination. And that's because the virus likes the cells of the respiratory tract, and you have more of those cells inside the nose than you do in the throat. So combining both the throat and the nose in research has shown to be a good option, especially when the child has symptoms. Next slide, please. So, third question, my child was sent home with symptoms and now they're fine. Is testing needed? Well, again, it depends. It's very important that parents complete the daily screening tool every morning before children go to school. But you should also complete the screening tool if a child develops symptoms and is sent home from school. And that online screening will help guide you as to whether assessment or testing is needed. So essentially, it's the same algorithm as I walked you through in the first question. Next slide, please. My child has symptoms. Does the rest of the family need to be tested or self-isolate? Can siblings go back to school? Can parents go to work? Children or household members of a child with symptoms most typically will be asked to self-monitor, which is something we're supposed to be doing every day anyway. The household members can continue to attend school or go to work as long as they don't develop symptoms themselves and as long as the child has not been diagnosed with COVID-19. There is a difference between self-isolation and self-monitoring, anyone who's sick should be self-monitoring. And these are all good practices that we should have been doing before COVID. COVID is really just an opportunity for us to hone these practices. And so when someone is told to self-isolate, it means as much as possible staying in a separate room away from other people in your home, using a separate bathroom if you have one. So that's really what you need to know is self-monitoring, self-isolating, and these are key really to ensure that those children who are at school continue to stay safe. So if I can have the next slide, please. And this is just to, because you may ask, well, you know, what does self-isolation look like for a family? You know, we're not living as individuals, we're living as a family unit. And the answer really is that it will look different according to where you call home. Whether you have people within your home sharing bedrooms, whether or not you have an extra bathroom or not, and how many people are in the home. So self-isolation is going to look different for you depending on your circumstances. Next slide, please. This is a fact sheet. Oh, sorry, Claire, can I go back? Thank you. This is a fact sheet that's been provided by Public Health Ontario, and it breaks it down, tries to make it easy. I think often we have questions about masking in the home. If you've got someone with symptoms, they should be wearing a surgical mask, not a face covering, in order to protect the others. There's sometimes questions about what kind of cleaning you need to do in a home. Use regular household cleaning and disinfection products for hard surfaces. They all should have what's called a DIN number. Health Canada has a chart that has the DIN numbers on it if you want to look it up. And that should be adequate for COVID-19. What's not adequate is vinegar. I love vinegar to clean my house. It's not good enough for COVID. And also laundry. You don't need to separate the laundry. You can do everyone's laundry together. Public Health Ontario recommends that you use gloves and that you wash your hands afterwards. Next slide, please. Okay, question number 5. My child received a negative test. When can they go back to school? So first of all, I think it's important to remember that anyone who is in the process of being tested needs to self-isolate while they're waiting for results. And the good news is that results are starting to come back faster. Right now, over 70% of the results are back here in Peterborough within 48 hours. So you can go online and you can check for your results. So once you get the results, if they're negative, your child can go back to school if these 3 conditions are met. First of all, if they don't have a fever without medication. I mean, if you're giving Tylenol every 4 hours or ibuprofen, you're going to mask a fever. But if the child has not had any Tylenol and they don't have a fever, and if it's been at least 24 hours since they've been improving, and they haven't been told, or you haven't been told by a public health nurse that they are a close contact and need to continue to self-isolate, then your child can go back to school. Next slide, please. Why are students outside not wearing masks? So this was one question we've had. I think everyone knows that right now the provincial guidelines are that children or students that are in school from grades 4 to 12 are required to wear face coverings while they're in school. Now the children who are younger are encouraged, but they're not required. Outdoor times like recess or physical education are really opportunities to provide students with a bit of a mask break. So it provides them with a break where they don't have to wear a mask. And one of the ways we address this is that we only let them outside in their cohort. So there may be 1 or 2 cohorts using the outdoors spaces of a school, but we try to reduce the numbers and give them some space, that physical distancing, so that they can remove their masks and get a bit of a break. If you've tried wearing a mask all day, you will find that it's not an easy thing to do. Next question, please. What's considered an outbreak in school? So we do have a definition, and it is a definition that's provincially mandated. So whether you're in Peterborough or you're in Timmins or you're in Windsor, all of the public health units are using that same definition, and it's defined as being 2 or more COVID cases in students, staff, or other visitors in a school that have some kind of a link within a 14-day period. Now, what kind of a link? Perhaps they're in the same cohort, or perhaps there was some other way we could link them, but it usually means they're in the same cohort, or if it was a staff person, maybe they, the classes, the different cohorts of that one staff person. And so if they meet those 2 criteria of 2 or more cases within a 14-day period with a link, then we would declare that as a school outbreak. I think it's important to note, though, that when we do declare an outbreak, it doesn't necessarily mean that the school is closed. We would close the school if we had widespread transmission as a way to try to close things down and control the outbreak. But if there is not widespread transmission, what an outbreak does is it gives us an opportunity to add a few more restrictions. For example, restricting visitors, restricting staff from working in other schools, putting up signage, potentially doing more cleaning and disinfection until the outbreak is declared over. And typically we need 14 days where there's been no further transmission in a school. And why 14 days? That's the length of the incubation period for COVID-19. And so once that incubation period is met, if there has been no further cases linked to the school setting, then we can declare that outbreak over. Next slide, please, Claire. With a positive case, why did Peterborough Public Health only call students in their cohort when these students had close contacts with others, not in their cohort? So what happens when we have a case? And I think it's really important that people understand this, is that we're the laboratory that does the testing must notify public health when there's a positive case. So we typically get those results faxed into us at any time of the day. Used to be any time of the night as well, but at any time of the day, we get that faxed into us, and we have 24 hours to contact that case and do a risk assessment. We would do a risk assessment if this case was in school, whether it was a staff or person or a student. That risk assessment includes finding out what cohorts that child is in. Potentially would mean speaking with you, the parent, to understand, do they take the bus to school? Are they in before and after programs? When were they in school during the incubation period, during that pre-symptomatic period? So we do our case, our risk assessment, and we identify the close contacts, both outside of the school. So if there's siblings or others, we would identify those as close contacts. But then for the school, it's really only those children in those cohorts that would be considered the high risk contacts or the close contacts. The way we do have a resource on our website called Close Contact or Not, and it defines for you what we mean by a close contact. And that is someone who has to be within 2 meters of distance with someone for a period of 15 minutes. And that 15 minutes could be spread out during the day, but it's a total of 15 minutes. And those are the people who are at greater risk for being infected with COVID-19. So that's how we do our risk assessment. And then the first thing we would do is we would advise the school. We don't disclose the name of the case, but we would say, we need this cohort and this cohort. We need them dismissed and we need the names. And then we go ahead and contact the cohorts. And sometimes, depending on the circumstance, you can sort of further select. So if it's a school bus, for example, sometimes you only need to dismiss the people within the first few rows around the case. You don't have to do the whole bus, but we usually dismiss everyone first until we can get to them and speak to them and determine their contact with the case. Next slide, please. So I heard about case such and such at X school. What do I need to do? Does my child need to get tested or stay home? Typically, when it's amazing how quickly the grapevine works, especially in a small community like Peterborough. And now the grapevine has accelerated through social media. So typically, we are calling a case to let them know, and the word is getting out, and people tend to get very frightened and want to do something. Whenever we're frightened, we want to do something, and sometimes we think, oh well, we should get tested. No. As I explained to you in the last slide, when we do our risk assessment and we identify the cohorts, as I said, the first thing we'll do is we'll dismiss the cohorts, or we'll call on an evening before the next day so that nobody gets on a bus and goes to school, and we ask everybody just to stay put. That gives our school nurses and our COVID team time to contact each of those people. And we have 24 hours after we've identified a case. We have about 24 hours to then contact all the contacts. If you build in a little wiggle room, I essentially within the first 24 to 48 hours of a new case, all of the close contacts will be contacted. And if we can't reach you, we'll leave a message and we'll say, you know, please call Joanne at Peterborough Public Health. We will leave you a message. So what that means is, and we have an excellent record. In fact, here at Peterborough, we tend to get 100% of our contacts within 24 hours. And so where that leaves us is that you can count on us that if you don't get a call, then your child can continue to go to school, does not need to take a test, as long as they don't show any symptoms. Of course, anyone who shows symptoms should self-isolate and get tested. That's for everyone. But if you have not been contacted by us, advising you that your child is a high-risk contact, they can go about their normal activities. You can go about your normal activities, and just make sure that you continue to screen every day before anyone goes off to work or school. Next slide, please. There's been a positive case in my workplace. Can I still send my kids to school? So this probably came from a concerned parent who's worried, who knows that, you know, you can transmit COVID-19 even before you have symptoms. You know, what if I'm infected? What if I've infected my child and now they've gone off to school? And, you know, should I keep my children home? Again, the same kind of risk assessment we do in schools, we do that in long-term care settings, we do it in workplaces. So if you were exposed, if you were a close contact to somebody in the workplace, you would get a call from us and we would advise you on to self-isolate. We would advise you which day to be tested, because typically with high-risk contacts, we wait until the 5th to 7th day following the exposure in order to reduce the likelihood of a false negative test. So we would ask you to self-isolate and we would ask you to go for testing on a certain day. If you haven't been contacted, then you and all of your household contacts can continue to go to work and to school. And the one thing I want to add here is that for those of you who are working, unless you're a healthcare worker, I would highly recommend that you download the COVID Alert app and put it on your phone, because it will notify you if somebody tests positive. They're given a code that they can enter into the app, and then the app sends a notification to anyone who was within 2 meters for 15 minutes or more. And if you go online and the only reason for testing is that you had a COVID Alert app, you can get a same day or next day appointment to be tested. So I would highly recommend that COVID Alert app for high school students and for anyone who's working. The only reason I said not healthcare workers is because we get in each other's space and we're within that 2 meter distance. So that app isn't going to be as helpful for a healthcare worker as it is for people who aren't typically within that 2 meters of distance. Next slide, please. I put these questions I found very interesting, and now these were both latecomer questions, but they demonstrate the two sides of the coin. Question number 11, will the Peterborough Public Health issue new guidelines above what's been recommended by the Ministry of Education for face coverings for children, similar to the ones that were implemented in Toronto? Versus the other question that came in the same time, will you consider the other side of the coin in this issue, masking, and assess the potential harmful risks to our children before making them mandatory, and repeal the mandatory requirement in favor of other measures like more distancing in classrooms while sitting at the desks? So we have parents who are very worried, who want to see face coverings required even for the little children. And we have parents who are very worried about the unintended consequences of face coverings and would like to see them repealed. And what I would say, I think the answer to both parents is what's on the slide here. And that is that the provincial guidance for schools is being provided by the provincial public health measures table, and they get scientific support from Public Health Ontario, and the Chief Medical Officer of Health is also involved. So those decisions that are going to the Ministry of Education are really based on the best evidence that we have available. And the latest requirements are based on evidence. It was last assessed in August and published by the World Health Organization, and that was the recommendation that for children, younger children, that they not be required, but that they be encouraged. And that part of that is because younger children might have a more difficult time with putting them on and taking them off safely or wearing them consistently. And so because of that, some allowances have been made. What I want to say to both sets of parents is that all of this evidence continues to emerge. As you know, we're building this plane as we fly it. And so the evidence changes, it emerges. What we believe today might be different than what we understand or believe 2 months from now. And so we will continue to monitor this. We'll continue to look at the evidence. If the evidence becomes stronger, then we might strengthen those recommendations. If it doesn't, we may keep it the way it is. If it looks like it does more harm than good in little children, we might actually go backwards. What I wanted to also say, and you'll see that last bullet point about weekly school outbreak meetings, we are also learning from our own experience here in Ontario. So all of the public health units have been meeting once a week and with Ministry of Health and with Public Health Ontario, and we share our experience about what we're seeing, what we're experiencing as far as risks, what works, what doesn't work. And in fact, we knew that adults were more of a risk than children just from our summer experience of childcare centers. And the other thing that we've noticed is that many of the outbreaks Ontario has experienced in schools have been because adults have gone to school sick. And so it just, again, reinforcing the need to do that self-monitoring every day and not to go to school if you're sick, but to stay home, to self-isolate, and to get tested. Next slide, please. So there are things that everyone can do to protect their family. And as I said, the most important one is stay home from school when you're feeling unwell, completing that screen every morning. And you know what? If your child only has one symptom, but you're still worried that it might be COVID, there's no harm in getting a test done. And in fact, in Ottawa, 17% of the children in school that had COVID only had runny noses. So you can't, if we're building in some flexibility, recognizing we may lose We may not be as sensitive, but we're also trying to make this thing livable for families. So if you are worried about your child and your child has symptoms, there's no reason why you can't have a test. Certainly washing hands, respiratory etiquette, avoid touching the eyes, nose, or mouth, because that's how the virus gets from our hands into our respiratory tract. Maintaining that physical distance, wearing a mask, avoid sharing items, whether it's water or food or e-cigarettes. And as I said earlier, downloading that COVID alert app as another useful tool. Next slide, please. So, you know, I'm sure as parents, you had no idea that you would be worried about, that you would know what self-isolation means or how to do it at home, or you would understand all the intricacies of physical distancing. There's no doubt that these are unprecedented times, and I think the longer we are you know, in this new normal, the better we will get with all of those measures that will help protect us and our children. Next slide, please. I want to talk a little bit about masks because I think there is some confusion or some potential for confusion. You'll see that when Peterborough Public Health talks about face coverings, we use the word face coverings. And for a face covering is a cloth mask with made of 2 or 3 layers that is recommended as a way to protect others from droplets. But in addition to face coverings, there are surgical or medical masks. And it's important to know that anyone who develops symptoms should be removing their face covering and putting on a surgical mask. The schools all have surgical masks. If your child becomes ill during the day, they will give your child a surgical mask to wear and to go home in as a way to protect others. And we recommend for people who are self-isolating in their homes, we recommend that they wear a surgical mask. And so anyone isolating should wear a surgical mask. We also recommend that anyone who's working within 2 meters within that 2 meter zone should be wearing personal protective equipment, which is comprised of a surgical mask and eye covering. And then Hospital for Sick Children has published some guidance for children who are, you know, are medically complex or who are immunocompromised, and they are recommending that those children would also potentially benefit from wearing a surgical mask rather than a face covering, because really it's about protecting them from others, and a surgical mask will do that better than a face covering. So I hope that clears up some of the confusion about, you know, when is a face covering enough and when do you actually have to go the next level to a surgical mask. Next slide, please. Yes, hand washing. Again, you know, I mean, I used to have to nag my kids to wash their hands. And I certainly, as a young parent, never carried hand sanitizer around. The times have changed. And so now children are washing their hands, know how to wash their hands, and also have the benefit of hand sanitizer when they're not close to a sink. When do you wash your hands and when do you use hand sanitizer? Well, if the hand is visibly soiled, then you need to wash them. And if they're not visibly soiled, you can use hand sanitizer. Next slide, please. We also wanted, although this webinar has been focusing on the infectious disease threat to our children, we cannot lose sight that all of these these public health measures and these distancing have put a heavy burden on families and on children. And certainly we know that children are more anxious These are uncertain times. They're picking up on the vibes. They aren't quite sure, maybe aren't quite sure of the threat. This is a bit of an invisible threat, and they will pick up on your cues as well. So we've put a couple of links here on the slide to some very good resources on mental health. Also, we encourage you to check your school's website. There should be resources there. Your family physician or nurse practitioner can also be that link for you to local mental health resources. Our school nurses will also be in the schools and promoting mental health. And there is a hotline as well, the Children's Helpline, if it's the weekend or an evening and you have a child in crisis. So please, please don't hesitate to reach out for those other very important supports if you or your children need them. Next slide, please. Now that's it. So that's it for the presentation, and we are now able to take questions. So over to you, Brittany.
Okay, thank you very much, Dr. Salvaterra. Thank you for all that great information. We have received some questions already in the chat box. And for everyone else listening, as I mentioned, please feel free to type in your question and we will do our best to get through them all. If we're not able to for time, then we will take note of them and respond after the fact in a Q&A document. So one of the first questions that came in was from Susan E, and she has asked, why are students wearing masks while exercising, whether they are physically distanced or not? This compromises breathing. Further to this, students are on lunch without masks indoors where they are at greater risk.
So a couple of parts. Certainly, students are eating within their cohorts in schools, and they are removing their masks indoors for eating and for drinking. So that's definitely happening, but they are supposed to remain seated. So hopefully there is distance between them and others. Again, hopefully they're in their cohort, because as I said earlier, we are using the cohort as a bit of a public health measures tool and strategy. As far as wearing face coverings while they're exercising, I'm not 100% sure why that's happening. Certainly, if they're exercising outdoors, there shouldn't be a need for wearing face coverings. Carolyn, I'm wondering if you, given your connection with what's happening in schools, do you have an answer for that question?
I would think there may be instances just based on the inability to physical distance that a teacher may be trying to go the safest route. And there may have been, perhaps there's an instance as well when there's an outbreak at a school and masking, universal masking has been requested as an outbreak control measure, that you might see masking at that point, but I would think it's more the exception.
Okay. All right, thank you. It sounds like we've got at least an initial answer there. So now I will move on to Emma, one of our guests, and she is asking, has there been any discussion about maximum class numbers for elementary schools? For example, currently 27 students in a grade 8 class with up to 5 teaching adults in the class each day. Could this number increase even higher following the transfer of students back and forth to the virtual school? And I would think that this is probably a question best answered by our district school board partners, as it has to do with school policy. But Dr. Salvaterra or Carolyn, do you have anything you'd like to add to that?
I think that would be the correct place to send that question, because we have told school boards that they need to physically distance the students as much as possible. And it really will be dependent on the size of their classrooms. I know many have removed furniture, have tried to create more space in those classrooms. And then, of course, as I said earlier, we're using the cohort as well as another way to try and minimize the contacts. So we don't set the limits on those class sizes, and I'm not sure. I'm assuming this comes up potentially, Carolyn, in your conversations with our boards of education. Would you have anything to add on class size?
Just that it is a Ministry of Education and it's related to funding formulas. So yeah, I think that's that one. And certainly we do know that some classes are being held in alternate sites, not in traditional classrooms, whether it's outdoors or in particularly in secondary school cafeterias or in elementary school learning commons or libraries, so that larger classes are able to have that physical distancing. Mm-hmm. And I think at the end of the day, the other piece that's really critical is that schools have really good record keeping, that if there is a case, we are able to isolate and get that cohort home and all of the staff impacted.
Okay. Thank you very much, both of you. We will forward that question to our district school board partners and attempt to have it answered as part of the Q&A document that we will prepare after this event. We do have another question from Susan E. again. In terms of physical exercise, yes, the students are outdoors in their cohort and unable to physically distance, playing soccer at recess with their cohort is the example. But I'm more concerned about breathing issues while exercising, such as breathing priorities before COVID. So.
Well, we do know that there are exemptions for wearing face coverings. So if there is a child, let's say, who has breathing difficulties, maybe a child that has chronic asthma, those children would be exempt. And we do know that, I mean, it's certainly, as I said, wearing a mask is a bit of a hardship. And so it makes sense to be able to remove that mask while the child is playing outdoors. The issue would be physical distancing and trying to create enough space for those kids. The risk of transmission really drops once you're in the outdoors. And so it is safer to play sports, I think, as long as there isn't physical contact. But it is certainly, we do see that happening, and masks, face coverings are not worn. So without knowing more of the details, Susan, it's hard for me to comment on the specific situation. But again, if you want to send something in writing, we might be able to look into it a little further.
Okay, great. Thank you very much, Dr. Salvaterra. And I'll just put a call out. Do we have any other questions from our guests on the line who are joining us? Okay. I think we've answered most of the questions tonight. So with that, thank you, everyone, and thank you, Dr. Salvaterra and Carolyn, for offering your insights this evening. This wraps up our presentation tonight. We're so pleased to have you join us and asking these great questions. We do encourage you to visit our website at peterboroughpublichealth.ca, and you can access the resources that we referred to there this evening. We will also send you a link, because as participants who've registered, we have your email address. So you'll get a link to the video and to the Q&A document that we'll be creating after this Teams meeting. So thank you again. Greatly appreciate everyone's time, and take care and stay safe out there.
Thank you. Bye.
Bye.